My name is Dr. Hopp, Robert Hopp. I'm a dermatologist here in Kennewick, Washington at the Center for Excellence in Dermatology, and I've created a video list of informational videos for my patients, covering subjects all the way from shave biopsies to melanoma to sunscreens and everything in between. They're short, informational videos of what I tell my patients, and their instructional drawings that I've included that I think help patients understand the subject that's being talked about. So I would encourage you to take advantage of these.
This video is about actinic keratosis. Actinic keratosis are a very common problem seen on a daily basis in a dermatology office, and they come from a lifetime of sun exposure. So ultraviolet light coming down and damaging the cells in the epidermis over a lifetime, causing those cells to grow abnormally and not mature correctly and present with a scaly area on the surface of the skin, typically surrounded by a little bit of redness, which is your body's immune system trying to destroy the areas of sun damage that the immune system recognizes as abnormal. So it's desirable to treat actinic keratosis because a certain percentage of them over time can progress on to a squamous cell carcinoma. So a squamous cell carcinoma is the same sort of process that penetrates down into the next layer of skin called the dermis. And at that point, it's classified, even though it's the same process, as a skin cancer. So the best way to prevent actinic keratosis is to protect yourself from the sun with sunscreen and clothing like a hat and that sort of thing. But it's good if you do have a lot of sun damage to get them treated periodically, usually on a yearly basis. And so the typical way that they're treated is to treat them with liquid nitrogen. Liquid nitrogen's a very, very cold substance that's sprayed on the skin typically from a bottle, and it actually freezes the skin and forms frost in the area for about 30 to 40 seconds. The way it destroys the cells is to freeze the water that's inside the cells, which causes the cell membrane to expand and rupture, just like when your pipes freeze in the winter. So liquid nitrogen applied to the skin will freeze the wart for about 30 to 40 seconds, and then it will thaw out. It'll become a little bit red and inflamed and tender for the next 20 to 30 minutes, and then it generally settles down, and the area forms a scab at the site of the previous treatment, and over a period of 10 to 12 days, the normal skin heals in underneath the scab, and the scab comes off. And what you should be left with is normal epidermis that matures correctly and is nice and smooth. The one caveat to remember is that if the cells are down deep in the skin, the liquid nitrogen, even though it feels like it goes down to the bone, is actually a very superficial treatment. And one of the first signs for a skin cancer is a recurrence of the site that has been previously treated, especially if there's been multiple treatments applied to the area. This would indicate the progression, perhaps, of a lesion onto a squamous cell carcinoma, in which case a biopsy would be indicated of the area.